Let's see, there you go. Apologize for being in the car, but sometimes life makes you mobile. So here I am. For those of you that don't know me, my name is Carl Judd. I am the national trainer for LBA. We're going to kick off in just a couple of minutes. Gabriel is getting some things together, and then we'll kick off. We're also waiting for a few more participants. We got about 30 some people on right now. So as soon as that gets a little bit higher, we'll go ahead and start. So give us about 5 minutes or so, and then we'll go ahead and kick off. If you have any questions in the meantime, though, you can go ahead and throw them in the chat box, and I will be monitoring the chat for the majority of this this call today.
Good afternoon. Good afternoon. Can everybody hear me? Mic check. Can you hear me?
We hear you, Gabriel.
Awesome.
Yes, sir.
Excellent. Excellent. Welcome, everybody. We're going to get started here in 30 seconds. Just giving a few more people that are coming in right now an opportunity to join, and we will get started.
Hey, Gabriel, can you see in the chat about that registration issue?
Hold on one second. Try to register. I put one up there. Yep, we're gonna hit on that today to make sure everybody's on the right track. All right, can everybody see me? Can everybody hear me? Give me a thumbs up. Awesome. All right, welcome everybody. Super excited to be here today. We got a lot of great stuff to cover. I'm Gabriel Burgos, president and founder of LBA, which is a Medicare and ACA company. And today I'm excited to go over our new process. Really, we're going to have kind of an open discussion. I want to kick it off with an open discussion and make sure that everybody is on the same page with our new process. As most of you already know on the call, we have a new back office that is unbelievable. They are the best in the industry with technology, support, and everything that you need to be able to get your appointments, AHIP certifications, and be ready to sell Medicare. So super excited. The name of our back office company is Spark. And of course, a lot of you will be getting emails from them and information to get established, and they're there to help you. We have an entire team that's there from 9 a.m. to 8 p.m. Eastern Standard Time to make sure that you have the tools needed to get going. So before I get into the next topic, what I'd like to do here is I would like to kick it off right now and start kind of a question and answer. So feel free to chime in. You can unmute yourself if you have a question. And this is regarding anything with LBA or the Spark process to make sure you're not getting stuck in any part of our process here. We want to make sure this is the time for you to ask questions, and Carl and I are here to answer those. So let me go ahead. I'm going to mute it out, and then go ahead, guys, start firing away. I see we do have a few in the chat, but go ahead and start asking questions here, guys.
I'm sorry. I was wondering about the registration. I tried to get registered to create my account so I can. I was watching the first YouTube video to get started, so I'm a little bit behind. But when I put my upline in, because I texted him and asked him, was that the person I was supposed to use? But he hasn't texted me back. But it says that it's invalid.
Okay, so the way it works, if whoever referred you to LBA and helped you get started, they have an agent code, or they're supposed to have an agent code with LBA. So they have to be registered with LBA for you to be able to use their code successfully. So if you're having a hard time registering, right, then that means they probably do not have an agent code with LBA, or they haven't registered themselves. So all you have to do is reach out to your upline and let them know, hey, if you want me on your team for LBA, you need to go ahead and get signed up with LBA first, okay? We have instructions. I'm going to upload those right now as we're chatting on how you get set up with LBA through the Better Income website. And once they're registered, you can do that. Now, for those of you on the call that are going to be direct, meaning that you heard about us directly from Better or an email or somewhere else, and you don't have an upline or somebody that referred you or recruited you, then you can go ahead and I'll type in the company agent code. It's BBB001, and that will, you can register in that manner as well, okay? So that's how that works. And I'm going to put here the instructions here for everybody now, so they can go ahead and you can get them registered. Good question, by the way. All right, any other questions on our process? This is the time to ask. If you're stuck with anything, if you're not sure on how to do something, ask. All right, so since no one's talking, I'm going to read some of the. Go ahead. Yep.
Sorry, one question. So I'm not health licensed, but my husband is. How does that work for both of us?
So you do have to have a health license, right? A lot of you on here have a life and health, but you only need the health component. So you would have your husband register with LBA so he can do his AHIP, his certifications, and get appointed with the carriers. But if you also, Sharon, want to be involved and actually sell Medicare, then you would have to get your health component as well.
Okay, and he is. I had to register first in order for him to. So we did that process, and then he went further with it, and I'm just trying to see. So is it for me right now, or should I wait until I get the health?
I would get him started right away, as soon as possible. I wouldn't wait. And then once you get your component of the health, if you want to actually go out and sell Medicare, then we can get you signed up and enrolled and everything like that.
Okay, thank you.
You're welcome. Good question.
So
all right, guys, any other questions?
Well, I have a question. So I'm certified with a different broker, with so many carriers. So how can I move all this to you? So do I have to start with the signing up? And then what is the next process?
So currently you are set up with Medicare with a different broker. Is that what you're saying?
That is correct. Yeah.
Okay, perfect. Yep, that's easy. So all you have to do is reach out to our Spark support team. Okay, I'm about to share that information here as well. And they will walk you step by step on exactly what you need to do. They actually will schedule a 30-minute call with you. Let me put it here right now. Give me 1 second. Everybody, I'm sharing a link right now. It's a Calendly link. If anybody on this call needs help getting transferred over, or they need help getting appointed, you have a 30-minute window that they will hold your hand through each step of the process. I just shared the link. It's going to pull up a calendar. You pick a date and time, and they are going to, we have Gia, her name is Gia in our back office. She'll get with you and she will walk you step by step on what we need to do to get you transferred over.
I have one more question. So do you have the list of the company that LBA is representing?
Yeah, we have all the carriers. We're an independent broker, so we have all the carriers, and they'll go over that when you're getting moved over and getting set up. They'll explain that to you step by step on what needs to be done there.
Okay, thank you.
Okay, I just shared the link, so you can go ahead and actually hold on 1 second. I'm messaging.
I don't see it.
Yeah, no, I'm sharing it with Bet McAfee. So let me do everybody here. Hold on 1 second. All right, let me know if everybody could see that now. Just give me a thumbs up. Perfect. Okay. All right,
Yeah,
Katrina, you raised your hand. Go ahead, dear. What's your question? Katrina, question?
I'm sorry, I was still on mute. I'm sorry. They were talking yesterday about the LBA logo, and I was trying to get a clear understanding. Is that from like our team, like if we were on Elite, Destiny, or something like that? Or can we pick our completely a different logo from all of that?
So you're asking about the LBA logo. In what capacity are you looking to use the LBA logo?
On the mailers and things like that, they said we could pick our own logo and thing. And so somebody couldn't get, a friend of mine couldn't get on. And so they're on the Elite team. And so she was wondering, do they put the Elite logo on there, or can she use a personalized logo, or?
Yeah, so you are actually set up with LBA, and we're here to help you build your Medicare agency and help you guys be successful. But you guys can absolutely brand yourself. You're welcome to use the LBA logo if you want, but if you're on a team like the Elite team and Jason Beauvais' team, or you have your own branding, that's what we're here for. We want you to brand yourself in your community. Get out there and be the Medicare expert. So you can absolutely brand yourself. You don't have to use the LBA logo. That's not a problem at all. We have a lot of marketing pieces that you can use that are white labeled, right? So you can actually customize it. And when you get onto the Spark platform, you're going to be able to see a lot of those resources there for you that you can use as well.
Okay.
All right.
Okay, thank you.
You're welcome. Okay, Arturo, question?
Yes, my question is, do we still use Sunfire to record calls and Lead Start for leads?
So that was through our old back office, which was Network. So now we are with Spark, and we're going to be launching some new incentives. So we actually are no longer using LeadStar, and we actually did not really like that platform. We got a lot of feedback from the agents that the quality of the leads were not good. So we are in the process, especially as we get closer to open enrollment right now. We're going to be launching some great incentives for the agents that are fully contracted and fully appointed to get leads or do direct mailers. And we're going to be launching that in an upcoming training. And we're going to go over, make sure you're signed up with the Better LBA channel, right? The network that we have. We post a lot of that information on there as well. So stay tuned. We still have Sunfire. Sunfire is part of the Spark platform. So make sure that you get enrolled and set up with the Spark platform so you have access to the Sunfire. And by the way, in 2 weeks, we're going to be launching a full training on the Spark platform. That's our next training that's going to be coming up. So we're going to be going over that. In the meantime, though, don't wait. You're welcome to reach out to our support team with Spark or click on the link that I just shared with everybody here. And you can schedule a 30-minute call and they'll get you set up. Make sure you're on the right track, Arturo.
Thank you.
You're welcome. All right, Pauline.
Hi, Gabriel. I would like to make sure that, so I just only want to recruit and override. So do I need to do the AHIP?
No, that's actually, Pauline, that's an awesome, awesome thing you just brought up. Thank you for bringing that up. So for example, guys, Pauline, she is a builder, right? She wants to build a Medicare agency, right? So she's not going to be physically with her own pen writing business. You do not have to be AHIP certified. You don't have to get contracted with the carriers. You don't have to do certifications, because LBA will pay you your overrides, okay? So you do not actually have to do anything other than take 5 minutes, get signed up with LBA, get your agent code. That is all you have to do, and start giving your people your agent code. Now, if you decide, Pauline, in the future that you want to write Medicare yourself, then at that point you would have to get AHIP certified and all of that. And but for now, you do not have to do it if you just want to build an agency, a Medicare agency. Okay, so thank you for bringing that up. That was a good point there. All right, guys, let me see here. How do you sign up for Better LBA channel? Okay, so let me share these instructions here, because I see a lot of you missed that. 1 second. All right, I'll share that here in a minute. Okay, so Virginia, I'll get to that. I'll upload that here. I know you're on the East Coast, but will you be offering anything in-person training? Okay, let's talk about in-person trainings in California. Yes, so we are in the process. If you have a big team and you would like to have boots on ground training, we have all the major states like Florida, California, Georgia, Texas, Nevada, all these areas. Reach out to us and we can coordinate and schedule an in-person training to make sure that you and your team have more of a hands-on Medicare training approach. And we can even schedule to do some field training as well if your team would like to do that. So Sonoma, just reach out to us. You can email support@legacybenefitsalliance.com, and we will be happy to coordinate. Somebody will call you and we will coordinate a date and time to get a trainer out there. So absolutely, we can do that. All right, any other questions while I'm reading on the chat here, the questions?
I have a question.
Yes, ma'am.
This week I wrote up something on Sunfire. Is that, do I have to change how I'm registered with that, or is that seamless?
So did you wrote a Medicare client, you said?
Yeah, on Sunfire.
So you should, if you wrote a client through Sunfire, was that through Network or through the Spark platform? Do you know?
It's just original. I didn't know about Spark.
It's through Network, Gabriel.
It's through Network. Yep. So it's no problem. You're fine, Betty. You could just business as usual. We're actually doing all the transfers internally, so you guys do not have to do that. So just continue to do business. We are going to be rolling out the Spark platform here. You should have received an email. If you haven't, reach out to Spark support so they can help you get set up with the new system, which also has the Medicare Sunfire. So once you're transferred over, and they can let you know if your transfer has already happened. And if it has, then you will use the new Spark platform, which has the Medicare or the Medicare Sunfire on there as well. But if you have any business right now, you just continue to write business as usual. Nothing changes from that perspective until your transfer happens. Okay.
I have one other question.
Sure.
You said Medicare and ACA.
Yes. So we haven't launched the full ACA. We have been concentrating on making sure that everybody has been set up with the Medicare side and everybody's on the right track there. But we are going to be launching the ACA platform here very, very shortly. My goal here is within the next month to get that launched out so everybody can have that ready to go in their arsenal when we have the open enrollment coming up here. So obviously, for those of you that don't know ACA is health insurance for anybody under the age of 65. You would be able, through the Affordable Cares Act, you would be able to sign them up for health insurance. Okay, so you will be able to help anybody. Anybody under 65 will go on ACA. Anybody above 65 will go on Medicare. So stay tuned, Betty. We will make sure to give everybody the updates as we get closer to launching. Okay.
I want really fast. So
Sure.
every year we have to do AHIP again, right?
Yeah, AHIP is a certification that has to be done yearly. It's on a yearly basis. We have our Spark support team that if you need help, you're struggling with that, just reach out to them. And they run weekly AHIP trainings, and they have staff standing by to help you to make sure that you pass your AHIP if you have any situation. The only thing you don't have to do every year is going to be your appointments. You only get appointment with the carriers one time, and you never have to do that. You do have to do the certifications every year, and you have to do AHIP.
Great, thank you.
You're welcome. All right, Noon.
Hi, Gabriel.
Hi, how are you?
Good, thank you. How are you? So, yeah, just quick question. So, if I got AHIP and everything's done, I got the client, but I don't want to do the deal myself. Can I give it to somebody else, or I could give it to the company, or how does that work?
Give it to me.
So that's kind of a sticky question that you're asking. You are technically supposed to do your AHIP yourself, right? But if you have
I'm gonna be doing the AHIP myself, but I want to focus on like life insurance investment and things like that. If the client like reach out to me, yeah, I have everything on the platform, but I don't want to like go deep down into the Medicare stuff. How do I do that if I don't have an agent under me yet? Yeah.
So if you don't have an agent under you, first of all, you should get one, right? You should have, everybody should have a Medicare part of their business, because if not, you're leaving a ton of money on the table in residuals. So I highly recommend that you recruit somebody on your team like ASAP and make sure that they're ready to sell Medicare. That's what I do, right? Just to give you a little background about me. So I personally don't write Medicare. I haven't written Medicare since I started. I'm actually going to start doing that a little bit because I want to be more boots on ground with you guys. But yeah, so I just feed my agents. They go out, they write the business, they make good money, and you're getting residuals and overrides on your team. Okay. But don't give that up, especially if you have senior clients and people that you're meeting with all the time for the financial side. I mean, that's huge residuals, 50% in residuals. So don't give that up.
So, but there's no split on the Medicare, right?
Yeah, so Medicare is not like life insurance where on an application you can actually put two names and it splits. You can split it with somebody, but once you get your commission, you'd have to give them, you know, a piece if that's something that you guys agree on. So anything that's paid on the commission side, because we start everybody at the highest contract, you get paid directly with the carrier. So you're set up direct with all companies and carriers. That money gets direct deposited into your account. Once you get those funds, if you want to split a sale with somebody, you absolutely could do that. It just gets a little difficult for the renewals at the, you know, the following year as it start paying renewals. It's a little tough. That's why Medicare doesn't have split sales like that. But the upfront, right? You know, it's $611. It just went up this year, by the way. And then it's half of that. In California, it's about $750. It just went up too. You get that up front, so you can actually split that. It's easy to split that. Okay.
Perfect. Thank you so much.
You're welcome. Good questions. Guys, go ahead, raise your hand or go ahead and chime in if you have any more questions. This is what we wanted to do today. I wanted to make sure everybody gets all their questions answered and they know what they need to do.
Gabriel, I have one more.
Yes, Pauline, go ahead. You ask good questions.
So I have security licenses like Noon. So there's not gonna be any conflict. We just only do OBA to TFA, right?
Yes. Yeah. If you have your securities license, just make sure you follow the regular channels to get an OBA. I'm assuming you will have to get an OBA on that. So yeah, just talk to your folks about that you want to do Medicare.
So one more, if I go on, okay, if I bring in the people that already savvy in Medicare in other platform, then you just can recruit them for me, correct?
Yeah, yeah, we do all the
Okay.
recruiting, we do the building, we do the training. You don't have to do any of that. Just send them over to us. We will take care of everything for you. Okay. Good question. All
Gabe,
right,
can
we
I-
have
Can I
Katrina.
chime in on this?
Just my last question on the address. Can you use a PO box address on your mailer, or what do you do if you don't want to use your own address?
Do you have an office address, or you're working at a home, or?
Oh, yeah, it's probably an office address. I can use the office address.
I would, I don't like to put my personal address on mailers, to people that I don't really know. So I would recommend you use, definitely use a physical office, or if not, you can use a PO box. That's up to you.
Okay, thank you.
You're welcome.
And then one more question with the AHIP test. So before you can start the whole process, you need to have the AHIP test done first?
You have to complete, step one is you got to do your AHIP. And
Okay.
step two, you have to do your contracting with the companies that you're going to sell, right?
Okay.
And then once you're contracted, then you'll do the certifications to sell the Medicare through each of the carriers. And again, our support team can help you and walk you through. I shared that link. I'll share it here again to make sure everybody has it. Make sure you schedule your Zoom 30-minute call, and calendar, just click on that link. It'll pull up a calendar, and you can pick a date and time that works for you. And you can go over, they're going to go over everything step by step to make sure to get you guys going there. All right, let's see. Can I move my book of business from another broker to LBA 2 when I sign up? Sarah, yes, you can, as long as the broker you are with is not holding you captive. Okay, that's very important. A lot of Medicare brokers or agencies hold their agents captive. LBA does not hold you captive. You own your book of business from day one. And if you ever want to leave for any reason, we will give you your release, no questions asked. We believe that everybody should own their book of business for their hard work that they're putting into this. But as long as they will allow you to take your book, that's not a problem. We can move everything over. All right, another question. Can you use your E&O insurance with WFG for Medicare? So a lot of you are in WFG. If you have E&O insurance already, you do not have to get a separate policy to do Medicare with LBA. That same policy will work. You do not need a second policy for that. All right, Leo.
Okay, so I'm in California, and this is new to me, the Medicare side of it anyways, but is there a certain, I guess, carriers we want to, or do we want to get the whole platform, whatever's there? I mean, is there a suggested amount or suggested providers?
Great question, Leo. So a lot of agents ask this question, right? Because think of it like life insurance, right? So life insurance, you've got, I don't know how many insurance carriers, right? You got, I think, over 60, 70, maybe even 100. So typically works the same way. You usually have your top 2 or 3 carriers, right, that you're going to write all the time because they're the best. It's the same thing with Medicare. There's no difference from that perspective. So what I recommend everybody do, I'm going to share a link right now that you can actually go on to this website and search the plans in your area, and it will tell you what the best plans in your area are. And I always recommend, if you're getting started, just set up with the top 2 or 3. I wouldn't do more than 3. You don't need more than 3, even though we have them all. You only need 2 or 3 to get out there and effectively be writing 95% of the people you're going to run across. And if you have a situation that you need a different carrier, we can always add that later, right? Don't stress yourself out about it. Works exact. So check this out. I'm sharing right now with everybody here. Follow this link that I just sent in the chat so you can search the top plans and carriers in any state or any city in the United States. It'll pull them all up here for you. Okay, that's the link that I just shared right now. Connie, marketing ideas. We've actually had marketing idea trainings. If you go to our YouTube channel, everybody should register to our YouTube channel. We record all these trainings and we upload them to our YouTube channel. I'm going to share the link right now, and you can go back there, and we have trainings that go over marketing ideas. So here's our YouTube channel. For those of you that are not registered yet, click on our YouTube channel, give us a thumbs up. And we have about 20 videos right now uploaded that go over different topics of training for Medicare. So feel free. Also, when you go on the Spark platform, let me share that here real quick with you guys. You're going to be able to, you have a huge amount of resources here on the Spark platform here. Hold on one moment. Share that here with you guys, so you can see what I'm talking about. All right, so this is actually our Spark platform here. So everybody, when you reach out to, here's the information right here, top right-hand corner, okay? If you want to take a picture or screenshot, support@sparkadvisors.com, or you could call 212-847-0697. They're open Monday through Friday from 9 a.m. to 8 p.m. Eastern Standard Time, okay? Give them a call for any support questions, hit extension 1, or platform support questions, hit extension 2. But everybody will have access here to the Spark platform, and we're going to do an in-depth training on this in the next week's training or following week's training. But this has a huge amount of resource. This is a full CRM system. It's got Medicare Sunfire. It's got the capacity for you to click and do your campaigns to send mailers to your clients. We're going to show you the power of this tool and system. But right here, we have something called the Resource Center. So for those of you that are brand new, we've got, let me show you how that works here. It's going to show you our entire resource center that we have for you guys, all the way from what we call Medicare one-on-one, all of that, all the trainings. We've got a full academy. It's all here on demand at your disposal. A lot of the questions that you're asking, if you don't have E&O insurance, you can go here and get a discounted rate through us. The AHIP information, it's all on here, okay? Everything here. So make sure that you call support@Spark Advisors to get set up with your login and password, so you can start playing around with it and make sure you're ready to get going. All right, guys, what other questions? Let's see here. We got more people joining here. Carl, you still there?
Yep, I'm here.
All right, make sure we don't miss any of these questions, as there's been a lot coming in through the chat, please.
Yeah, I'm seeing, oh, okay, never mind. I'm not in the everybody channel. And just,
Yeah, make sure you got
Sure.
everybody selected here.
Gotcha. Change this.
Hey, Gabriel, could you put that link in the chat, that Spark link?
Sure. Let me give me 1 second. I'll share that here. I'll share that here in a minute. And by the way, guys, don't forget to go to the network, the LBA channel network. A lot of these resources are all on there. So make sure that you go on there. You've got everything you need to get started right on that channel. We post it right on the feed. Just scroll through there and you'll see that a lot of this stuff we've already shared with you guys. Kevin, question.
Yeah, that was just me. Anyway, so I got the question answered. I'm trying to. Anyway, I'm good. Thank you.
Okay, yeah, no problem. No problem. Let me share here the Spark link here, so you guys have that. See if that works. Click on that. Let me know if that link worked there. Should. But if it doesn't, let me know. But that link should work. The last one I shared was the Spark platform link. And again, you have to get set up. So make sure you reach out to the support team so they can get you set up with your login and password, so you have access to the Spark support platform. All right, guys, any other questions here? Make sure this is the time to go over questions. That's why we're doing this today. A lot of people are confused on the new process, what they need to be doing, what the next steps are. And I just want to make sure that everybody, you have us here. You've got Carl, you got myself here in person, ready to go to answer your questions, guys. Carl, any other questions we missed or anything you want to chime in on that we didn't cover so far, Carl? Feel free to chime in.
Yeah, I do want to say that I know we're a couple of months away from open enrollment. However, things are starting to open up to prepare for that. So for example, AHIP is now open. You can go ahead and get that done. Like Gabriel said, if you need help, you can go through the Spark support channel to get assistance with that. If you really find yourself in a bind, you're welcome to reach out to me and I can help you with that as well. But you're also starting to see carrier certifications that are opening as well. So right now, if you're just joining LBA, one of the neat things about how AHIP works is you can go ahead and get your 2024 AHIP done, and it will count from now until the end of 2024. So if you have business that needs to be written for the month of August, September, October, any of those months, and you completed your 2024 AHIP, you can still use that AHIP as long as you certify with the carrier and write that business. It's kind of one of those things where if you're just joining on, it kind of gives you a few extra months of AHIP for no additional cost.
Yep, good point there. Good point. So yeah, if you do your AHIP certification, because now we have the 2024 AHIP open, it will cover you for the rest of 2023. So you can write business immediately, right off the bat.
Yeah.
Hi, I have questions.
Yes.
Yeah, I'm brand new for that. I'm with Nun team. Anyway,
Welcome.
yeah, I have to start. I'm just make appointment with your company regarding about AHIP training. But anyway, question is, if I enroll someone is a midi, like a Medicare and Medicare, do I still get the commissions?
If you enroll somebody, I'm sorry, what was that?
It's like a midi, like they have the low income. This means they not have to pay for the Medicare, monthly Medicare. Okay, then do I still get the commissions for the enroll someone in the Medicare program?
Gabriel,
Yes.
I'll answer
Go ahead.
that.
Yep,
in general, I would say yes. There are a couple of plans, and there are very, very few and far between that do not pay commissions, but the majority of all plans, Medi or regular Medicare plans, will pay commissions. When you look at the plans, generally they will tell you if they're non-commissionable. So if you're looking to stay away from those types of plans, you should be able to do that with no problem.
Do you have the website or the link I can study on that? Because we don't enroll people in the wrong thing, working and get nothing back.
Yeah, so when you get into Sunfire, and again, we'll be doing that training in 2 weeks, right? You'll be able to see all the plans that are available in the county that you're working in, or at least the zip code. So as you go through that, most of those have some kind of highlight or an asterisk or something that lets you know if it's non-commissionable. I'm not aware of anything in California that's not commissionable right now, but I can do a little research, and in 2 weeks, I'll try to answer that question.
Thank you very much, Carl.
Sure.
Thank you, Gabriel.
Yeah, you're welcome. Great question. All right, guys, I'm going to share here. I want to share my screen. If everybody wants to take a picture of this, here is the next steps, okay? If you are not signed up with LBA, all right, here's what you need to do. Step one, you're going to go to betterincome.com. So you got to get set up within the Better Network because we are a Better partner business. So you're going to get signed up. You're going to get your agent code. Then what you're going to do is you're going to go to step two. You're going to log back into better.com or betterincome.com. You're going to go to the top right where it says get appointed. You're going to scroll down to the bottom. You're going to see the LBA logo. Click on that, and then you're going to sign up for LBA. Your agent code is going to be the same for Better and LBA. We share one agent code to keep things simple for you guys. And then that is literally all you need to do. And the lady we spoke to a little bit ago that wants to build a team, that's all you got to do if you're not going to be writing with your own pen the Medicare side, and just start bringing in your Medicare people and getting them set up under your platform through LBA. And then as far as getting contracted, you're going to go, there's a link that everybody's going to receive, which is this link right here. And it's going to allow you, it takes 5-10 minutes to complete, and they'll start working on getting all your contracting. That gets sent directly to Spark. Spark receives it. They start processing you. They get you into the system and start getting you set up with all the carriers. And then once you're AHIP certified, once you're appointed with all the carriers, we move on to step 4, which is you're ready to sell. We're going to schedule a call and a marketing strategy call with you to get you started and make sure you have you can start producing and writing Medicare business. Okay, so everybody take a picture of that. Make sure you have that step by step there.
Gabriel, I have a question about that.
Yes.
So those that have been with us for a little while and signed up with Network and are converting over to Spark, what is their process once they have completed their stuff that they get from the email? Are they still going to set up a marketing call with them as well?
Yes. So if you're already set up and you're already appointed, once your transfers are moved over to Spark, yes, you can reach out directly to Spark or email Spark support, and we'll schedule that training and that marketing meeting with you to get you going and provide you any support, whether that's leads, mailers. We want to invest in you, and that's what we're going to do. Everybody that's ready to sell and ready to go, we're going to put money up front. We're going to pony up money up front for you guys so you can get out there and start selling Medicare. So if you're on this call and you're ready to sell right now, you need to reach out to us right away so we can have this marketing strategy call with you and get you going ASAP. Okay.
Gabriel, it's Pauline again.
Hi.
Okay, so if my agent already qualified for Medicare themselves, 65 years old and above, can they get commission on their own case?
So you mean are they going to write themselves on Medicare?
Yes, can they do that?
Yes.
Carl, that's not a problem, right? For somebody to write themselves on the Medicare side?
Nope. Everybody who I know that's an agent that turned 65 writes their own policy.
Yep.
Okay, great, perfect, thank you.
Yes.
Hey,
so that
Gabriel,
is-
I got on late. Where's the AHIP training to get the AHIP training?
Yes. So for the AHIP training, I'm going to share that link right now. Bear with me. For those of you that have not completed your AHIP certification, I'm going to share a link right now. And again, reach out. Here's all the, real quick before I get to that. Want to share important contacts. Take a picture of this page right here. If you need to get a hold of anybody in our team, here is our Spark back office support. 100%. They're open 9 a.m. to 8 p.m. They're sitting down. We call it the CPT team. They help with contracting, the Spark platform, and training. They're open 9 a.m. to 8 p.m. Eastern Standard Time. Make sure you call there. Do not hesitate. Call them. They're there to help you guys. If you need any help on sales or training, Carl, that's on the call here today, he's our executive national trainer. He can help you coordinate to schedule an in-person training. So we're doing boots on ground trainings all over the United States. So reach out and he can help coordinate that. And then you've got myself. I help with the recruiting and building. My job is to grow LBA and help you grow your agency and build the agency. So reach out to me and we could schedule a time. We'll get on my calendar and discuss the details on what you want to do. Support at legacybenefitalliance.com. Please take a picture of this screen right now. And again, we are going to upload this to our YouTube channel in a couple hours after we finish this training. Now, let me share here, Kevin, let me share the link with you on the AHIP. That's a good point you brought. Thanks for asking that. So anybody that has not done their AHIP, here is the link to go and do your AHIP certification. Hold on one moment here. It's got all the instructions on exactly what you do. If you follow this link, you are going to get a discounted rate. You're going to get $50 off your AHIP certification if you go through Spark and our platform, LBA platform. So make sure you follow this link. The normal cost to do AHIP certification, that's a state certification through CMS. It's required. It's $175. If you use this link, it's only $125. This is required. This has nothing to do with LBA. This is the state that mandates it, or the federally that's mandated.
Is
All right,
that
so-
the same? Is that the same link for if you're doing it again for the year?
Yeah, for 2024.
It's the same.
Yeah, every year you'll use the same link, and you'll have it on your Spark platform. Okay, but I'm just sharing it because Kevin asked us. So right there, guys, I just shared it. Everybody got it? Give me a thumbs up. Somebody click on it, make sure it's working. Okay, if something's not working, please let me know. All right, good. Thank you, Suzanne. So guys, click on that and it gives you step-by-step instructions on how to knock out your AHIP. If you need help with your AHIP, okay, please reach out to our support team. We have people standing by to make sure to help you pass that AHIP. I want to be honest with everybody on this call. If you're brand new to Medicare, do not get discouraged. The hardest time in Medicare is your first year, because you have to do AHIP, get appointed, and get certified. It's a lot to do, but hang in there. It's going to be worth it, okay? If you can make it past this first year, you are going to make Medicare a huge part of your business. It's one of the most lucrative passive income business available in the United States right now. If you're securities licensed, you know that you only get 1% under management or a small commission. This pays 50% overrides every single year on the renewal basis for the rest of that client's life, as long as they don't pass away or switch plans or go with a different agent. That's why we help you keep track of your book of business and help. We provide a dedicated customer service for all of your clients that they could call in at any time. But huge, guys. But hang in there, guys. I just want to give you guys realistic expectations. The first year, it is a lot, but it is worth it. All right, so yeah, you have the AHIP certification. What else, guys? Any other questions before I hit on the next topic here? We got about 10 minutes left before we end this meeting. Ask your questions now, guys.
I have a question, Gabriel.
Yes.
What are some questions or concerns a client might have when we're on the phone?
So Arturo, that's going to be more of a training-based question. We're going to go over that. Please go to the YouTube channel because Carl does great. He's done some great videos regarding that. So take a look at that. I would focus on the certifications and getting going right now, and we will make sure you're ready to go. And a lot of times it's the same questions that you'll get over and over, but we will cover that and make sure that you're prepared as you start getting ready to, meet with clients and things like that. Okay.
Yeah, let me tap into that too, Gabe. So Arturo, if you go into the YouTube channel and look at the trainings that are labeled pages 1 and 2, right? You will see there won't be a lot of questions, because what you'll do is you'll start that conversation as an educational piece. You'll explain to them all of their options with Medicare, everything that they can do. And then what you're going to do from there is you're going to look at their personal situation and start finding solutions. So what I find in the, almost 20 years that I've been doing this, that will cut out 99% of the questions, except for, you know, does my doctor accept that? Except we're already going to ask that question, right? So if you haven't watched the pages 1 and 2, I would encourage you to do that. And then that will make sense, that there won't be a lot of crazy questions that are asked by the client, and you're really more taking control of that sales situation.
Thank you.
Thank
Hey,
you,
Gabriel,
Carl.
quick question.
Yes.
Recruiting wise, I know sometimes with like life insurance, you're recruiting other agents, they have to wait like 6 months before they can leave. Is that sort of how it works with like Humana and United Healthcare and stuff like that? Or how does that work?
So it's going to depend. That's a great question, Kevin. So if you hire a Medicare professional in the industry already, that's with a different broker, as long as their broker gives them their release, typically we can get them moved over right away. If they refuse, let's say they're captive, they're going to have to submit for a internal release with each of the carriers. And by the way, we help them with this whole process. Okay. So they don't have to do this on their own, and we'll guide them on the fastest and quickest way to do this. But sometimes they might have to have a waiting period before they get transitioned over. But while they're waiting, they can continue to write. So it's not like they're going to be sitting in purgatory of Medicare. They will be able to continue to write while that transition is switched over. But send them to us right away, because we have ways around that. Right now, as we get closer to open enrollment, the closer we get to open enrollment, the harder it is to get people moved over, because the carriers stop transfers because they want people concentrated and focused on writing Medicare in business instead of switching around from place to place. So just keep that in mind, okay? All right, Patrina, you have another question?
Yes, I did Medicare probably about 4 or 5 years ago, and I did the AHIP, and I got appointed to like Aetna in several groups. Will they still have my appointment to them after? I never wrote anything, because once Medicare season got open, nobody was there to help me, so I couldn't figure it out on my own. So I just did all the work and everything like that, but I never sold anything with it. That's why I was discouraged with Medicare.
Yeah, no, I got you. No, you are gonna most likely gonna have to get reappointed again. Okay.
Okay.
So yeah, if it's been that long, 3-4 years ago, you will have to get reappointed. If you're not actively with your broker, you will have to. Okay.
Okay. Okay. Thank you.
And we'll make sure that doesn't happen to you this time. We're going to give you all the support and make sure you're ready to go and write business. Okay. We want you to make this a career and make good money doing it. So that's our goal here.
Oh, well, that's good to know, because I sure did. I wasted a lot of money the last time. And then when it was time, all the agents went to their people and I didn't know what to do with them.
No, not a problem. Not a problem.
Thank you.
We'll help you. We're here to help you each step of the way. Okay. Guys, any other questions? Any other questions?
Good morning, Gabriel.
Good morning.
I have a question. We just passed our AHIP in June 2023. We never got appointments. Can we still use that certification issued to us in 2023 for next year?
If you talk about your AHIP, you got to do the 2024 AHIP, which starts for open enrollment October 15th. That's going to cover you for all of 2024 and the rest of 2023.
Oh, so right now, until when can we use our 2023 certification?
Till October. If you want to write for October for 2024, you have to do your new certification.
Okay, so we need to enroll again.
You have to do your AHIP again, correct?
Correct. Let me also tap on that too. If you're going to write business in October that will have an effective date for January 1st, you have to have your 2024 AHIP complete. So just because we're in 2023 and you might sit down with a client while it's still 2023. If the effective date of the policy, which I'm generally talking about open enrollment, if that effective date is going to be January 1st or later, you have to have your 2024 AHIP to be able to write that business.
Okay, so as an AHIP certification needs to be renewed every year?
Yes.
Yes.
Okay, thank you.
And Gabe, I know we're getting short. The last thing I want to say before I let you take the rest of it is, right now it's kind of a prime time if you're building a team over the next 30 days to try to get recruits in, so that we can get them, AHIP certified with the carriers, trained, and have a marketing strategy for them going forward into open enrollment. Open enrollment will start in October, technically October 1st. You can't write business until the 15th, but October 1st, we can actually start showing plans to clients. So here we're at the end of July for the most part. And so to have enough time to be able to effectively get people up and running, and if you're building a team, within the next 30 days is probably the hardest push that you would want to make for this year, so that we can get them contracted and all the stuff done for them to be effective for open enrollment.
Okay.
Yep. Yeah, that's huge, guys. So right now, that's what I was getting ready to hit on. We got to make a big push. If you want to build a team, you want to be ready to go for this open enrollment, this is the time to do it right now. Do not procrastinate. For those of you that are builders and want to build a big Medicare agency, do not miss out on this open enrollment, guys. This is go time. This is going to be a gold mine for everybody that gets started with trails, renewals, and building their Medicare agency. So I really want to push on that as part of the topic today for recruiting and building. This is the time right now to really make a big push so we can get them certified and trained and ready to go so they could sell during the open enrollment period. All right, so make sure, guys, do not procrastinate. Huge, guys. October 15th, first, officially we start writing in October 15th. So we are running out of time. I know it's July, but it takes time to get through this whole process. I just shared a link. I know somebody had a question here. Sydney, you had a question that you asked if we went over the commissions. I just shared the YouTube link to our channel that I go over personally, the entire commission structure, how it works, how much money you can make doing Medicare, how much money you can make building a Medicare agency. It's all covered in that video that I just shared right there. So everybody make sure you click on that link right now. I just shared it in the chat so you can watch that. It's a really good video for you to watch and understand the commissions, trails, and the power of Medicare, okay? Another thing that I want to share here with you guys, very important. I need everybody that's been with us since the beginning. If you are already set up to do Medicare and you are set up through our old platform with network, I am talking to you on this call right now. I need you to follow the link that I am pasting right now. I just shared a link. You need to go on to that page. It takes 10 minutes and you need to get set up to get contracted with Spark through the new Spark platform, okay? We are no longer writing business through Network Insurance, which was our old partner, okay? Follow that link. It takes 10 minutes to sign up and get your contracting switched over. We take care of everything else. When it gets to the page that it's asking you about the carrier, you're going to have two options. You're getting set up new with that carrier, or you're doing a transfer. Let's say, for example, you're set up with Aetna and United Healthcare already. You're going to hit transfer, okay? And that will automatically get you transferred over to Spark and LBA's new platform, okay? If you've never been appointed with that carrier and you want to get set up with that carrier, you're going to select new. Click on new, and then they will get you set up with that carrier and appointed right away. So follow that link. If you were already with us from the beginning, you're ready to sell. By the way, you can continue to sell right now. It's not going to affect anything you're doing. Continue to write, but we will get you on our back end transition over to the Spark platform. Very important what I just shared with everybody. Leo, question. I'm going to give it 2 more minutes, guys, and we're going to end this meeting here to be respectful of everybody's time.
Cool. Thank you. I was gonna say that, you know, you guys had mentioned about organizing or putting together or having some groups request some boots on the ground training. For those that are not in that team, would that be shared with other residents? Say, for example, in California, there's a group. Would I be informed about it so I can possibly attend?
Absolutely, Leo. So right now we're working on getting a big training set up in California because we have a big presence in California. Marla Cedro has a huge team there right now, and I'm trying to coordinate with her on a date and time. And this is, guys, we are a separate company from WFG. We don't have anything to do with WFG, okay? We're LBA and a business partner. So you guys, we all work together as a team. We're not segregated here. We work together. So if we host an in-person training, let's pack the house. It doesn't matter if you have a different upline or not. You are welcome to join and participate in the training so you can get full training hands-on, okay? So no problem there, Leo.
How
Guys,
much for the platform fee per year?
what was that?
The fee for the platform, how much we have to pay per year?
There's no fee. LBA does not charge a fee. Currently, it costs nothing to recruit and build a team with LBA. And everything we just shared with you, other than AHIP, right? You have to pay for AHIP because that's required by the federal government. CMS requires that. Other than that, there's absolutely no other fee. Obviously, you got to have your license, so you got to cover that if you're not licensed. And obviously, you have to have E&O insurance that you have to cover. But most of you already have all this in place, so there's absolutely no fee. The Spark platform, the Medicare Sunfire, all the training, I mean, everything that we offer is absolutely free to our agents, which is millions of dollars in resources that we're giving you guys. And this could change in the future as far as you know, later on, there might be a registration fee to get onboarded with LBA. But right now we've waived that because we're growing and we want to build this massively and encourage you guys to bring people on board. So there is no cost at all, zero. All right, guys, I'll take one more question and we are out of here, guys. Anybody else have a question? I see one here in the chat. It says, under my understanding is WFG E&O will not cover this platform. If you have E&O insurance for life and health, you are covered. You do not need a separate policy, okay? All right, guys, we're going to save this. We're going to upload it to the YouTube channel. It should be uploaded in the next 2 hours. It was great talking and seeing everybody today. Don't hesitate to reach out to Spark support team. We're here to help you. Let's grow this Medicare business huge. Take care, guys. Chat soon. Bye-bye.